about two techniques yesterday. One is systematic desensitization and aversion therapy. We discussed both of these. I am audible?
Yes, sir.
Yes, sir.
Hello?
Yes, sir.
Okay,
Yes.
good. Okay. So, those things comes under classical conditioning mostly. And today we are discussing about this operant conditioning methods of behavior modifications. So, screen also visible to you?
Yes, sir. Clear.
Yes, sir.
Yes, sir.
Okay. So, the second method is reinforcement responsive steps. In operant conditioning, reinforcement is the major role. So, there are several methods by which behavior modification therapy functions. Basically, desired behavior is rewarded and negative behavior is punished normally. So, here, positive reinforcement, that means for desired behaviors, what is the positive? Here there are four things are there. I told you yesterday also. Positive reinforcement, negative reinforcement, positive punishment and negative punishment. When it is a positive, how it will become a punishment, you may get doubt. Just if you go through, you will understood. Positive reinforcement is the practice of offering a reward for good behavior. And when there is a good behavior, normally people will offer some reward. In schools also you see the persons, those who are completing in time homework and all, teachers for encouragement purpose as a reward, they will give a small gifts like pencils, a small tokens like that. This is positive reinforcement for a good behavior. The reward or reinforcer strengthens a positive association with the action, thus making it more attractive. You might give your child extra screen time when they do their homework directly after school. Normally, children's we don't give screen time, looking TV or looking phone, all these things. Suppose if the child has done homework without anybody incision, if they do, we will give, okay, 15 minutes I am giving screen time for you, like that. So that will motivate the child to do homework regularly without anybody insistence. So this is a one way positive reinforcement. This expected reward gives the child motivation to complete a chore they may not otherwise be eager to tackle. Even if the children are not interested to do, because of the extra screen time, they are interested children normally, they try to complete the homework. It is a positive type of reinforcement. And negative reinforcement. What is negative reinforcement? Negative reinforcement is a behavioral concept that involves the removal or avoidance of an aversive stimulus to increase the likelihood of desired behavior. By understanding negative reinforcement, we can gain insight into how it influences behavior and its effect. Example also it is going to come, you see. For example, in negative reinforcement, how it will be. If a child completes their homework promptly, their parents may remove the chore of doing the dishes for that evening. Normally, children in the house, they do some other works also, helping to the people regularly. Suppose earlier in positive reinforcement, what we said, if you complete the homework without somebody help in time, without insisting by somebody, you will get some extra screen time. There we are adding something benefit. Here, in negative reinforcement, we are removing some difficulty work regularly what she is doing by doing the homework in time. Suppose in the child is doing some extra work in the house other than her class work. She is daily cleaning some dishes. Okay, if you complete your homework in time, you need not clean the dishes. That means, as a reinforcement, they are removing. Even though removing is a negative also, the behavior will improve here. So this is called a negative reinforcement. Positive reinforcement also improve the behavior. Negative reinforcement also, by removing certain difficult thing, definitely the behavior will improve here. And coming to punishment, we told in the beginning also, in operant conditioning, reinforcement and punishment are the main things to improve the desired behavior. Positive punishment is a common behavior modification technique used to stop unwanted behavior. Positive punishment. But this can be a confusing one. How can punishment be positive? But just as with reinforcement, positive and negative mean adding and taking away. So a positive punishment technique involves adding something punitive to a situation as a consequence of negative behavior. For example, some people may add an extra mile. See, this is a positive punishment. Example, how it will be, see. Some people may add an extra mile to their run if they ate a pint of ice cream the night before. Suppose yesterday night, the person ate more ice cream. But more ice cream eating is not a good thing, no? So that type of behavior they want to reduce. For that, what they are doing, punishment as a punishment, daily when they are doing some physical exercise by running, today you have to run extra mile because yesterday you have ate more ice cream. So you have to run today, instead of 2 kilometers, you have run 3 kilometers. So this is a positive punishment because by running extra, he will get some positive, no? And how is the negative punishment? Negative punishment is the act of removing something as a consequence in order to stop bad behavior. For example, a parent may take away a child's favorite doll if they won't share it with a friend, or withhold dessert if a child won't eat all their vegetable at dinner. Here, the reward they are going to remove. Earlier, you are watching daily 1 hour TV. Your behavior is not good. What mother will do? Today I am cutting your TV watching time. So child, what she will do? To enjoy the TV time, she will improve her behavior because she don't like cutting her enjoyment time. So she will try to do the work in time. So like this, reinforcement, positive reinforcement, negative reinforcement, and punishment also, positive punishment, negative punishment. This type of behavior modification techniques will be used in school, in the house. So for using normally in our house also, some parents, they are already without even knowing also they are following. But this is the method of reinforcement theory. Explain this. This was given by B.F. Skinner in operant conditioning. Any doubt?
No, sir.
Okay. So far we completed 2 methods. One is classical conditioning method, another is operant conditioning method. Now we are going for behavior modeling. by showing the behavior, what behavior we need, or by imitating a good behavior also, the behavior will be learned by people. This is called behavior modeling. So it is the precise demonstration of the desired behavior. According to theory, we learn not only by doing, but by watching what others do. We are learning the work, we are learning the behavior by doing it, or by watching others also. So this theory explained very well by Albert Bandura. I think you are all know Albert Bandura behavior modeling learning theories by watching, by imitating others. So good behaviors can be learned. Yeah, Bobo. How children will learn. There is actually aggressive behavior, how children learn in Albert Bandura explained by one theory. So in a therapeutic setting, behavior modeling is purposeful and positive, teaching clients healthier behavior. The importance of modeling and imitation in behavior is self-evident for children as well as adults. They are able to acquire complex responses and eliminate emotional inhibitions merely by watching how others handle themselves. Okay. In modeling, the client learns new skills by imitating another person. Naturally, it is happening. We are all seeing day to day. Such as a parent or a therapist who performs the behavior to be acquired. Here also one example we are giving. For example, modeling may be used to promote the learning of simple skills such as self-feeding for a profoundly mentally retarded child. Generally, profound mentally retarded children, they are totally dependent, but they can't do any type of works normally. But by regularly modeling a work, this particularly profoundly mentally children or even severely mentally children, by seeing or by observing others, self-feeding. Otherwise, they can't feed self. Somebody has to feed them the milk. But these children, by imitating, we can teach this type of very low skill works. However, behavior modeling can also be, sometimes it is harmful also, behavior modeling. How means, such as a parent passing on a prejudiced way of dealing with others. A friend teaching a child to use drugs. So, in the society, we are seeing this modeling, particularly the teenagers and young children using drugs just by observing others and following others and imitating others. So, this behavior is also happening. So, not only positive things, behavior modeling, and some negative aspects also there. So, we are discussing that one. So, modeling, classical conditioning, operant conditioning, and modeling. And another two techniques are there. Another one is token economy. Token economy is a technique. Suppose you take the example of school. For good performance in the school, see, in a class, every student will not have a good performance or a good behavior in the class. Those who are having good performance, regularly coming to school by in time, and regularly completing homework without somebody forcing or asking. And in the class also, they will be very, very good performance in academically they are showing. So naturally, the school administration, the school teachers, what they do, They will give some tokens to particular students, those who are performing in the school, behavior-wise, performance-wise, all these things. They will give some token. Token means it is exchangeable for some other good thing, which the children more like. For that thing, they can exchange with the tokens. See, even in shopping mall also we are seeing, if you buy something, they are giving some gift voucher. With that gift voucher, whatever you want, you can buy in particular shop. It is like that only, token economy. Through token economy also, children, after gathering so many tokens, they utilize those tokens for their whatever they like, eatables or some toys items or some gift items, they can buy with that tokens on free of cost. So by seeing the already tokens achieved some children, by seeing those children, the other children also try to improve their performance to get the tokens. So like that, in school environment, this type of token economy system, even nowadays also, in almost all schools, they are following this. And token economy is effective because it reinforces positive behavior without the need for immediate rewards. And in token economy, we need not give immediate reward. Only we are giving as a reward the tokens only. The tokens, when they will exchange, that is their wish. It also provides a visual presentation of progress, which can be motivating for individuals. Token economy is commonly used technique in ABA therapy. ABA therapy, applied behavior analysis. So this behavior therapy particularly used for modification of some problematic behaviors, and for autism children also, normally they use this ABA therapy to bring some improvement in their behaviors. So particularly this token economy is used only to reinforce some positive behaviors and for teaching new skills. Evaru? No, 2006. Okay. Any doubt in token economy?
Clear, sir.
Okay. And next, the last technique is in behavior management is assertiveness training. Assertiveness. So assertiveness is a training, behavior therapy or skills development program that teaches individuals how to behave more boldly and self-confidently. Here, some children, even some elders also, they are not having self-confidence. They are very submissive in their behaviors. We can say one way they don't know how to behave in certain situations. So for those type of situations, children definitely by behaving like that submissively, but they feel a lot of problems. So they need some training. For them, we give assertiveness training. Assertiveness training means whatever you want to say to others. But some people are feeling if we inform this type of thing, others will feel. So assertiveness means we can convey the information, whatever we want to convey, in right way and without suffering to others. That means you are standing for your rights. We can say you are standing for your rights. Assertiveness training can be particularly useful to those who have difficulty standing up for themselves. They feel sometimes to ask for their requirements also. Why unnecessarily we have to ask? They will feel. That is submissiveness normally. To reduce the submissiveness, assertive training will help a lot to children and elders without hurting others. We can convey the messages through assertive training. That is the skill of assertive training. This is one technique will be used particularly in classroom or in behavior management, even for elders also. Because of assertive lackness, they are suffering in day-to-day their activities. For them also, the assertiveness training is very, very important. In assertiveness training, we should know how to say no, particularly. Because many people are suffering without saying no. That means for everything they are yes. Saying yes is easy, but implementing for their request is difficult. So be assertive. Tell your difficulty also, why you are saying no. Then they will understand others. They don't blame you. So how to say no is also very important to improve our day-to-day performance, to reduce our unnecessarily suffering with others. So this is assertiveness training. So, and you are having other chapters also, na? Some other chapters after this?
Yes, sir.
Response.
Society's response to maladaptive behaviors.
Yes.
And the challenges
Challenges of
prevention.
Okay. I hope you can understood all these things by reading. Na? There is no much techniques in that. It is only a reading material. Whether you agree or not, it is only a reading materials.
Yes, sir.
Correct or not what I am saying? Anyhow, I will discuss something about that also, because today is the last class and the ending topics are there something. Please wait 1 minute. Okay. This one, Lina? Hello?
Yes, sir.
Yes, sir.
Yes, sir.
This is very easy topic, Amma.
Yes, sir.
You can read, everybody can understand very happily without any difficulty, because here there is no much technicality. Anyhow, I will read. Society responds to maladaptive behaviors. Normally, society will not respond positively for maladaptive behaviors. Actually, as a citizen of this country, we have to understand the difficulties of maladaptive behaviors. people's difficulties. See, wantedly, nobody is doing that type of maladaptive behaviors because they are having some problem. Suppose a low intellectual person, low IQ person, behavior is not up to the norms of the society. But what we are all doing? We are all criticizing him. We are not supporting those persons. The real thing is, we should support them to improve their behaviors. We have to understand their conditions. That is positive way of response to the maladaptive behaviors. But society is not following it. That is only the problem now we are going to read in this book. So society tend to look at maladaptive thoughts and behaviors as matters of personal problems. But it can influence and play a crucial role in mentally ill people condition to make either better or worse by its way of responding to maladaptive behaviors, by funding the self-help care centers, institutions which work for these people, can help in prevention and resilience in children and adults. Resilience. We are all resilient people. Something happened in our life, even though on the spot we may be somewhat distressed, immediately we will come back to normal position. That is called resilience, because we are all normal intellectual people. We are having resilient power. We will come back to from that situation, bad situation, to normal situation immediately. But whereas coming to the mentally ill people or low intellectual people, they will not come back to their original position on their own. So they require some support. Society has to take care, home has to take care, or teachers has to take care. Many people intervention is important to improve their conditions. Many people means it is society, ultimately society. That only we will discuss in this lesson. Causes of maladaptive behaviors. Why maladaptive behavior is getting caused? Certain social problems like poverty, poorness, and racism, showing some discrimination, casteism, social status, socio-economic status. Social status is different and socio-economic status is different. And recognition, etc. can mar the self-esteem and growth of person which can feel the person's mental health. Normally in the society, the poor people are getting discriminated. Through racism also, people are getting discriminated. Casteism also getting discriminated. And social status, we are high society people, some people are low society people. We have to eat food by sitting on the tables. Somebody has to eat food by sitting on the floor. So these are all the social discriminations. So this type of social discriminations also, continuously they are undergoing with the social discrimination, their mental health will get effect. So that is one of the cause for maladaptive behaviors. Problems such as juvenile delinquency. So juvenile delinquency is another aspect. Mental retardation and marital problems, domestic violence, smoking, alcoholism, divorce and poor living conditions and wars. All these things will create some type of mental health issues. Mental retardation will have some effect on their total socially functioning. And marital problem also will create unnecessarily a disturbance in the living of the people. Domestic violence. So all these causes create maladaptive behavior. Maladaptive means nothing but abnormal behavior. Abnormal means away from normal. Maladaptive behavior, society cannot agree because it is against to the social norms. So these are all maladaptive behaviors. And next cause is causes of delinquency. In children particularly, poor physical and economical conditions at home and neighborhood. They will get some neglect from others. It will create some mental health issues, some pain. And rejection or lack of security at home, those people also will suffer. Exposure to antisocial role models within or outside home, antisocial peer group relationship. All these things will affect and cause the delinquency, particularly in children. Okay. So this type of problems in the children's problem, the maladaptive behaviors, how society has to respond, that is also a problem. How to prevent those type of situations? So in our book, they given primary prevention, secondary prevention, and tertiary prevention. That is the reason we are all having, even in physical health problems also, medical causes also, primary healthcare centers, secondary healthcare centers, and tertiary prevention healthcare centers are there. Here, what is primary prevention? How we can prevent primarily to avoid those type of problems? Primary prevention focuses at preventing new psychological problems before its onset. So prevention is better than cure, people are saying that. So before onset, before affecting those problems, it is better to prevent, they are saying. Most of these efforts focus on education by creating awareness in children and teens about drug use and its effect, smoking, sexual abuse, alcoholism, premarital sex, and early pregnancy. So all these problems, most of the things happening because of their lack of awareness, knowledge. So by educating in this area, so before affecting those type of problems, by creating awareness at least teenage level, we can reduce, we can prevent this type of problems. And what is secondary prevention? Secondary prevention involves efforts to detect psychological problem early before they turn into more severe and chronic in intensity. Already the suffering people are there. But suffering people, we cannot leave them as it is. Society has to detect. So by detecting itself, we can take some curing measures. We can take some treatment methods. That is called secondary prevention. Already the disorders prevailing with some people, we have to identify those people. We have to provide proper interventions to those people in secondary prevention system. Primary is only before affecting itself. We can, by educating, creating awareness, we can avoid, we can prevent. Secondary prevention is already the diseases has come. The mental worries, mental disorders has affected people are there, but identify those people and give some interventions to reduce their disorders. And tertiary prevention, what is tertiary? This type of prevention focuses at people who are already diagnosed as having an illness or some type of behavior disorder. Tertiary prevention aims at reducing the impairment. See, already the people are having certain disorders. So it will create unnecessarily some impairment without treating it properly. So to avoid that type of impairment in the person's functioning, so tertiary treatment will be happened. So this is one type of levels of preventions. How to prevent? Perspectives. In what way we can prevent? One is situation focused preventions. Focuses at reducing and eliminating the environmental causes of disordered behavior. This approach seeks to change environment into less stressful, where if it is going to be reason for maladaptive behaviors among individuals. Suppose if it is going to be reason for maladaptive behaviors among individuals means such as divorce in families, corporal punishment in schools, child labor, drug addiction, factors can create deviant juvenile delinquents from the society. So these are all by situation focused and by improving competency of the people, competency focused prevention. This perspective focuses on strengthening coping skills. See, if we don't have some coping skills, everything will become a problem. Unconsciously, in day-to-day, we are using a lot of coping methods. So the competency-focused prevention means strengthening coping skills, communication skills. The aim of this early education program is to prevent or reduce problems in subsequent years by increasing children's ability to identify problem, to see relationship between alternative approaches, and to appreciate the consequences of their actions. So these are all the preventive perspectives. And next, where we can prevent? Site of prevention. In the family, something we can do. Spouse abuse, parental conflict and divorce, family of mentally ill adults. And next, the school, at school level. And what are the ways, diverse pathways? Community psychology. So this is very important. As a psychologist, we can go to different communities, even a place away from our place also. Voluntarily, we can have some community meetings by educating them about all these problems, gathering people at community center and creating awareness how these psychological problems developing, how these maladaptive behaviors are developing. For that, as a community, what precautions we can adopt, this type of things we can do. As a social worker, we can work like this. If somebody is having social worker interest, in community level working is a very good thing. and para-professionals. We are all called professionals, developing para-professionals. Now, in our society also, there are para-professionals working at grassroots levels and training them, giving required training to the para-professionals also. They will work at the grassroots levels. They will educate the people and they will identify the conditions also in the first instance itself. So para-professionals training is also very important because higher level people cannot go to grassroots levels for each and everything. Only the grassroots level working people are somewhat low skilled people. See, there is a difference between a doctor and a nurse. Nurses can work at lower level, doctors will work at higher level. So, even though it is a teamwork, but para-professionals are more numbers and professionals are less numbers. So, for working at grassroots levels, creating awareness, para-professionals are very, very important. Self-help groups. In our society, we are having self-help groups. They will also identify, they will also provide necessary help people, those who are suffering with maladaptive behaviors, because self-help groups are there. When most of the people requirements are not met by the professionals, they can find the hope and personal support they need in self-help groups. See, if you go to in very rural areas, they may not available some professionals, but self-help group people are there. At least they will find out the people concerns and they will create some understanding about the where they will get some help at least. That type of help they can do self-help groups. So the preventive measures we discussed so far. Any doubts, Amma? Anybody want to interact in these topics?
No, sir.
Why no, sir? Please, Amma, this is the main role. See, we are all educated. We are appearing for exams. We are qualifying, getting certificates. We want to do some practice. But that is very, very important as a human being for our self-livelihood. But same time, we professionals has to take some part in the society in the areas of prevention. For that only, we have to work in social groups. At least throughout year, at least 2 times, we can go to some areas. We have to arrange some community programs. We can create some awareness. Then only these preventive activities will improve. This is our social responsibility. Please tell me, sir.
So this maladaptive behavior is not only for children, right? Even for the adult also it can be, right? Any stage.
Any stage. See, drug addicts are there. It is a maladaptive behavior. Na? Smoking is there, drinking is there, and forceful sex activities are there. So many things. See, which is not normal in society is everything is a maladaptive behavior.
Okay.
But some difficulties are also there. I am agreeing. See, in our society, more people, what acts they are accepting, that is normal. Today, okay, we are discussing in books only. Most of the people are drinking alcohol. Is it so easy to go and talk in community, not to drink alcohol? Is it easy? No, because we are, even though we educated them in any way, in some areas it has become a social activity, social norm. And some people are even saying, I am a social drinker, I am not a regular drinker. That means they are feeling drinking is not a big problem. In this type of situations, definitely it is a challenging job for professionals. So in some cultures, the problematic things is becoming very normal nowadays. And
Sir, are these paraprofessionals, Anganwadi workers can be called as paraprofessionals, sir?
yeah, ma, tappakunda.
Okay. Okay, sir.
Anganwadis are doing lot of help for reduction of particularly these disabilities.
Okay, sir.
See, they are feeding, even they are identifying the pregnancy women, poor pregnancy women. They are supplying nutritional food, some nutritional activities from government side. They are helping, because poor people will not have good nutritional food because of lack of nutritional food. Their babies are having some problem. To avoid all these problems, Anganwadis are doing very good job.
Yes, sir. Thank you, sir.
Sir, this Anganwadis being paraprofessionals can be considered under self-help group where they initiated some kind of programs to the people around in this locality.
See, self-help group people, they don't get anything from government.
Okay.
This Anganwadi people are getting some salaries.
Mhm.
Self-help group means it is one way we can say volunteerism.
Okay.
Voluntarily you can do.
We'll try to do with this group one day, sir.
And now the last chapter is having is, what are the challenges in prevention? Challenges are there, some challenges for prevention also. Even though you know how to prevent, how to create awareness among the public, but there are some challenges. Even professionals also facing the problems. So in your book, it is very clearly, it is there, you can read all these things, very normal material. So out of all the 23 units, so far we come across, last from 16th class, this is 16th class and last class. So you may have some doubts. I invite people, if anybody is having any doubt, out of all the 23 units, we can make a revision once again. Let us come out.
Yes, we have that one. We'll do the complete deep study, then we will definitely come across with that.
Be clear, sir. I am not clear your voice.
I'm saying when we'll do the proper study after this, the deep study.
Okay.
That time I think we'll have that. Now everything we explained, understood.
Okay.
Sir, I have one doubt, sir.
Please.
When we write about the meaning and scope of psychopathology, it's in the definition it's given as it's written as the meaning is more of abnormality, sir. So is it different from abnormality and normality? It's the same. Is it the same, sir? Did you get my point, sir?
No. Psychopathology means some abnormality only, psychopathology. Definitely. Normality will not come in psychopathology.
Yes.
The meaning of psychopathology means studying the causes for psychopathology. What factors causing psychopathology is more important in psychopathology.
I think finding the problems.
Not only finding problems, by knowing the causes.
I think it will come under a diagnosis also, sir.
Yeah, see, ఇప్పుడు pathological lab antaru medical lo.
Yeah,
There
yeah,
is a
correct.
pathological lab.
Yeah.
What they will do? Pathological lab people,
Testing
they
exam,
will collect
examination,
some samples.
samples.
They will test it. They will
Yes.
give some results.
Yeah,
That
yeah.
means
Correct.
ultimately, what problems are there? What are factors causing this problem?
Yeah, yeah. Say report.
Psychopathology also study of abnormality and finding the causes also.
Okay, okay. Analysis.
Yes, it is required. Psychopathology and scope. Coming to scope. Scope means psychopathology where is having scope.
It's a limitation.
It is now it has become unlimited. Everywhere psychopathology is coming.
So where it is and move to, it's a period of so the situation, how it will be there. So we need to find out the, so this will happen into the scope.
Ultimately, psychopathology is coming, is developing in the society, in the people, because of various reasons.
Yes, sir.
Various reasons. There is some biological causes also there. Societal
Yes.
causes is there.
Yeah.
And
Yes,
psychological causes also there. How this
Correct.
psychopathology coming psychologically? That means psych, mind problem, how it is coming? Some biological problems also creating problems in the mind.
Yes.
The neurotransmitters imbalance in the body, the hormonal imbalance in the body, also creating some psychological
Okay.
problems.
Yeah, correct.
So this is a biological cause.
Yes, sir.
And societal causes, in society, we are getting discriminated with some class of people regularly.
Yeah,
They
correct.
are discriminating us. That means we are feeling so much inferior to them.
Yeah.
They are
Correct.
making us to feel inferiority. If you
So-
feel regularly inferiority at low
Yeah.
level, psychologically you will have some feeling, no?
Depression.
Yes, depression will happen.
Yes. So more nervous, anxiety.
Yeah, yeah. See, biological causes and
Yes, sir.
societal causes and psychological causes.
Psychological.
So, these abnormal behaviors, that is the reason WHO, World Health Organization, has given a definition of the causes for this psychopathology is biopsychosocial problems.
Problems. Correct. Psychosocial problems.
Social problems.
Yes.
So we cannot say only one area is creating problem.
Some multiple areas in multiple
It is
variations.
biopsychosocial related factors only creating problems.
Yes, sir.
So studying of all these problems comes under psychopathology.
Psychology. Correct.
There is a lot of scope.
Yes, sir.
And coming to, we discussed only biological problems and society problems, how they are creating psychological issues. And psychological means what? Our thought process.
Okay.
Our thought process, how it is getting influenced for some problems.
Okay, okay.
Suppose some way of illogical thinking is there, or our thinking is irrational, distorted thinking is there within us, automatic negative thoughts are entering into our mind, into our brain. So we are perceiving things differently because of automatic negative thoughts.
Unexpectedly.
I told you also in the earlier classes.
Yes, yes.
The event is not the problem. How you perceive the event is a problem.
Yes, sir.
All the people not perceiving event equally. One example I will say. There is a wife and husband. Because wife is working in one company, wife is getting very frequently calls from office. Some while talking also calls. Sometimes she is serious, sometimes she is laughing with the other people. Okay, the husband, how he perceive that type of things? Sometimes initially he may perceive it is part of her job.
Yes.
Another person, he will perceive my wife is doing some extraordinary behavior.
Yeah, it
And
depends
third
on
person,
person mentality.
yes. And third person is perceiving this is not correct behavior. She might have some other wrong thing.
Okay. He will think wrongly.
Yes. But here, the person who is wrongly perceiving, he will have some problem psychologically.
Correct. Mindset problem.
Yes. He behaves so much angrily and he suspects the persons.
Yes.
And he will have some relation problems. Relation problems will increase. They will put him in more anxiety or depression or stressful conditions. To reduce stressful conditions, he may addict to some alcohol.
Yeah, he is having
By
trouble.
consuming alcohol, he may create lot of problems.
Correct.
See, all are linked to chain of problems.
Yes.
Okay.
Yes, sir.
So psychopathology is a very important topic. In future, if you want to become a counselor,
yes, it is very important.
You must know biological causes, societal causes, and psychological causes for this problem. Then only you can counsel somebody.
Yes, observation and giving the suggestion.
Otherwise, it is very big problem, no?
Yeah, if we don't know, it will become major issues by analyzing and giving suggestion also.
Yes, sir. So psychopathology, that is the reason they put you in principles of psychology, social psychology, psychopathology, lifespan development. All these things are interrelated.
Yes, sir. It's a linked.
Without knowing one subject, other subject cannot be understood.
Yes, we won't understand.
That is the reason many times I told psychology, please don't take any choice, read everything.
Yeah. Correct, sir.
So any other thing? How the today morning 2 classes has gone?
Good, sir. Fine.
Good, sir.
So all the topics completed in other subjects?
Yes, sir. Nearly completed, sir.
Principles of completed, maximum portion completed, sir.
Principles of psychology, huh?
Yes, sir.
What about social psychology?
Social psychology, some chapters not covered, but Janardhan sir gave ఒక అవుట్లుక్ ఇచ్చారండి ఎట్లా కవర్ చేసుకోవాలి.
Okay.
లాస్ట్ లో ఇంపార్టెంట్ టాపిక్స్ ఆయన కవర్ చేశారు.
Okay, because within this short time we cannot detailly we cannot go everything.
ఎట్లా అన్నారు మేము చదువుకోగలమని కొన్ని చాప్టర్స్ అట్లా కొన్ని అవాయిడ్ చేశారు.
So main topics are covered, sir.
That is only I am saying, try to understand within this short period we are unable to cover entire thing.
Yeah. So as per time period, so we can't cover everything. So main topics only covered.
Guidance
so
to
don't
cover all the topics.
Please don't mistake ours.
Yeah, no problem.
Not at all.
We understand.
So whatever maximum help we can provide in this short period, we have done it.
Anyway, sir, we got an idea through offline and online classes. We have a confidence to at least to write something about psychology, and we already understand. We know something, so we got a strong idea about the psychology. We will improve our knowledge in between time.
We were confused, sir. All are interlinked. How to start? The limitations ఏంటి అనేది ఫస్ట్ తెలియలేదు. ఆఫ్టర్ కంప్లీటింగ్ ద ఆఫ్లైన్ క్లాసెస్ అండ్ ఆన్లైన్ క్లాసెస్ we got an outlook and we got the parameters to cover the portion ourselves, sir.
Okay. So Janardhan Reddy sir has given any idea examination format, how it will happen, questions,
Sir,
how many questions?
అట్లా ఏం లేదు సార్.
Sir, will you please share one list?
అట్లా టెక్స్ట్ బుక్ వెనకాల మోడల్ పేపర్ ఉంది కదా, అదే ఒక్కటే చెప్పారు అంతేనండి.
ఓకే
సార్ ఒక చిన్న డౌట్ సార్.
చెప్పండి అమ్మా.
సార్ ఇప్పుడు ADHD చిల్డ్రన్ ఉన్నారు కదా సార్, వాళ్ళని ఇంట్లో మెయింటైన్ చేయాలంటే ఎలా సార్? వాళ్ళు మన మాట వినాలంటే అసలు ఏం చేయాలి?
దానికి ట్రైనింగ్ ఉంటదమ్మా, ట్రైనింగ్ తీసుకోవాలి, పేషెంట్స్ ఉండాలి, అబ్జర్వ్ చేయాలి.
అంటే ADHD ఉందని మీరు ఎలా చెప్తారు అప్పుడు? మరి ఫస్ట్ అసలు
ఐడెంటిఫై చేయాలి కదా.
హైపర్ సార్, దేర్ ఆల్ క్యారెక్టర్స్ ఆర్ హైపర్. ఏది చెప్పినా వినరు, మనం చెప్పేది అసలే వినరు, అన్నీ నాకు తెలుసు అనుకుంటారు.
ఓకే, అంటే దీనికమ్మా ADHDకి పర్టికులర్లీ ఒక మంచి టెస్ట్ ఉంది. వాండర్బిల్ట్ ADHD అసెస్మెంట్ టెస్ట్ అని ఒకటి ఉంటుంది. వాండర్బిల్ట్ ADHD అసెస్మెంట్ టెస్ట్ అని ఉంటుంది అనమాట. ఆ టెస్ట్ కనుక మనము కండక్ట్ చేస్తే ఎవరైతే మనం అనుకుంటున్నామో, ఒక చైల్డ్ అనుకుంటున్నామో, ఆ చైల్డ్ మీద మనం కండక్ట్ చేయాలి.
వాండర్బిల్ట్ అసెస్మెంట్ టెస్ట్,
వాండర్బిల్ట్ ADHD అసెస్మెంట్ టెస్ట్ అని ఉంటుంది అనమాట ఒకటి. అది కనుక చేస్తే డెఫినెట్లీ వీ కెన్ ఫైండ్ అవుట్ whether the child is having any inattention problem, hyperactivity or other conditions. ఇంకేమన్నా ఉన్నాయా? ఈ టెస్ట్ అనేది ఒక 5 రకాల కండిషన్స్ని ఫైండ్ అవుట్ చేస్తుంది అనమాట. సో ఒకవేళ దాంట్లో ఉన్నట్టుగా కనుక ప్రూవ్ అయితే ఆ టెస్ట్ ఎట్లా నడుస్తుందంట? టెస్ట్ యాజ్ పర్ DSM క్రైటీరియా ప్రకారం వాళ్ళు ఇస్తారనమాట. ఇప్పుడు 10 కండిషన్స్ అబ్జర్వ్ చేస్తే దాంట్లో ఎన్ని కండిషన్స్ ఉంటే మనం ADHD ఉంది అనొచ్చు అని ఆ టెస్ట్ నేర్పిస్తుంది. ఆ టెస్ట్ కండక్ట్ చేయాలన్నమాట ఎవరికైనా కానీ. చేయకుండా మనం ఊరికే పిల్లవాడు చెప్పినట్టు వింటలేదు, చెప్తున్నారు. ఇంకోటి అమ్మా, ADHD కండిషన్ ఓన్లీ పేరెంట్స్తో చైల్డ్ ఉన్న కండిషన్ బట్టి మనం డిసైడ్ చేయకూడదు. ఒకే సెట్టింగ్లో కాదు, 2 సెట్టింగ్స్లో కూడా సేమ్ బిహేవియర్స్ ఉంటేనే మనం కన్సిడర్ చేయాలి. ఫర్ ఎగ్జాంపుల్, ఇంట్లో పిల్లలు తల్లిదండ్రులతో ఉన్న చనువుతో, ద మోర్ యాక్సెస్ విత్ ది పేరెంట్స్, దేర్ బిహేవియర్ మే బి డిఫరెంట్ బికాస్ ఆఫ్ హై ప్యాంపరింగ్ ఫ్రమ్ ద పేరెంట్స్. చిల్డ్రన్స్ బిహేవియర్ ఈజ్ డిఫరెంట్ ఇన్ ది హౌస్. Suppose if they go to other places or school, how they are behaving, same behavior they are exhibiting in school also, then it is a problem. Suppose children are having problem only in the house and they don't have any problematic behavior outside the house, that we cannot consider as a ADHD. Because here the domestic conditions, environmental conditions creating the child should behave like that. In the school, the environment is different. In the school, the child is very calm. Then, ఇప్పుడు చెప్పండి అమ్మా, మీరు ఇందాక అడిగిన క్వశ్చన్కి చెప్తే కూడా వింటలేదు అన్నారు కదా. ఈజ్ ఏ స్కూల్ గోయింగ్ చైల్డ్?
Yes sir, he is a school going child.
Okay, how is in school?
స్కూల్లో టీచర్స్ అలాగే చెప్తారు సార్. స్కూల్లో కూడా ఒక దగ్గర కూర్చోడు, చెప్తే వినడు, ఊరికే ఏదో ఒకటి సర్దుతూ ఉంటాడు. మేము చెప్పిన దాన్ని రిపీటెడ్ గా మాకే చెప్తూ ఉంటాడు.
In that case, better to take him to for assessment of ADHD assessment. తీసుకెళ్తే కనుక they will really confirm what type of problem is causing that type of behavior అనేది మీకు గైడెన్స్ దొరుకుతుంది. ఇప్పుడు all these things are happening because of lack of awareness only. Anyhow, now you are a psychological student, you got some awareness, so you can proceed accordingly.
Okay, sir.
Because prevention is always better than cure. సో ఎక్కువ డిలే కూడా చేసుకోవద్దు ప్రాబ్లమ్స్ ఉన్నప్పుడు.
ప్రాబ్లం అవుతుంది వల్ల.
అలాగే సార్.
Good thing.
Sir, I want one suggestion, sir.
Please.
Sir, when nowadays children are exposing to social media, right, sir? In kid shows also, they're through modeling, they're expressing some aggression is there in social, like cartoons that shows also, sir. So after they watching, they can express that things on other children's that type of behavior, sir, an aggression type. Or if anything like hero they're expressing, how can we get out of from that?
So it's like a more influence will be there with other people because of watching like a Cartoon Network, right?
Not only cartoons, everything is there.
Yes. Influence
only the thing in your psychological principles of psychology also there is a theory, Albert Bandura, social learning theory. Same thing now you are saying. Children will learn things by observing and by imitating.
Yes.
So it will be there. Watching only, sir. How can we get out of from that?
ఇప్పుడు వాచింగ్ ఎవరు అలవాటు చేశారు? Who had made practice? Parents కదమ్మా.
Yes, sir.
Obviously.
Parents only created that type of atmosphere in the house.
Yes.
So ఏదైనా children will learn anything very faster, but if you ask them to unlearning is very difficult. It takes a lot of time. For learning only 2 days is sufficient. For unlearning you have to suffer for 1 year.
Yes, sir.
So
it will take time. Correct.
Because even though as a parent, if you take some precautions in the house, avoiding all these things, but when your children's going outside, when they have discussion with other children, they are all looking, na?
Yes, they will do it there.
So that is only I told you social influence.
Correct.
Biological, social, and psychological. So here in this situation, we can say it is a social influence. In the family also society is there.
Yeah.
Because parents has allowed in the beginning, they don't have restrictions. But we have to, nowadays we cannot control children without seeing YouTube, all these things. But what we can do is we can fix some time. Some time schedule we can provide for every activity. Not only seeing this activity is important, other activities also important for you. So this is the time you are allotting for this.
We need
Even
to give
if you,
time.
See, I told you today in this topic, negative reinforcement. Suppose if you behave in this way, I will reduce your
punishment.
See, those type of things. See, ultimately you are asking, my child is looking more time on screens, he is becoming aggressive. So ultimately you have to reduce the screen timing time and creating his interest in other activities also. That is more important.
Okay, sir. Okay, sir.
So you have to take some professional advice, Amma. Don't just go on continuing like this. Because
No, sir, I'm not talking
effects.
about screen timing, sir. Just only in adults also, sir. They're watching and they're imitating.
Yeah,
That's
it will applicable. Mama, it will applicable to children or male also. Okay, same thing we need to apply. Slowly we need to give the...
You are saying male also, the elders also, by watching some aggressive videos, they are behaving like that.
Yes, sir. So many are there like that. It's a common for everyone.
It's
The media
nowadays
is
it's common, sir. They are watching movies also for crimes also. They are watching and do and practice on
Oh,
that also.
they will see everything in phone like a YouTube, whatever.
Aunamma. See, as a parent, we are looking in the house up to 11 o'clock. How the children will sleep? We have to sleep first. Then they will stop. We are watching. How we will ask them to stop watching? They don't stop.
Sir, one thing I will tell you, sir. Sir, parents will sleep early, but kids will not sleep early. Then automatically they will get out and they will watch up to 12, 1 o'clock, sir. I have seen so many families in society.
Hello.
Sir, all families are not following proper conditions in their house. We
Yes,
are thinking majority people what they are doing is a normal. We
Yes.
are suffering, na?
Yes, finally suffering will be there. Yes. So they need to observe
You want
and
to
care about
you
the
want to
children.
avoid suffering means you have to take some precautions.
Yes,
That is
precaution.
most important.
Yeah.
So I hope I have given
Yes, sir. Yes, sir.
some type of support to all of you students in psychopathology subject.
Sir, you
Yes,
are
sir.
given
Thank
lots
you.
of support. So I think your pronunciation and explanation, it's a very, very nice, sir. So I'm
Yes,
very
sir.
happy with your conversation and class, everything. I
Because
enjoyed
I
your
am
class.
working, because I am practicing na day to day.
Yes,
This
yes.
is my way of work functioning. That
Yeah,
is the
yeah,
reason.
yeah, correct. It's a way of presentation and everything. It's a superb, sir.
Yes, sir. Your slides and pronunciation, that some words, difficult words we have to pronounce. That is very nice.
Actually,
Thank you so much.
sir. One thing I want to say is I'm not feeling like you are your professor and I'm not a student. It's a link to, it's like a friendly nature.
క్వశ్చన్ పేపర్స్ షేర్ చేస్తారా సార్?
Hello? Hello? Hello?
Sir.
హలో
Somebody is
సార్.
talking. Cheppandi.
సార్ క్వశ్చన్ పేపర్స్ షేర్ చేస్తారా సార్? ఏమైనా
క్వశ్చన్ పేపర్స్ నేను షేర్ చేస్తే ఇంకేమైనా ఉందమ్మా అసలు?
ఎక్కడ సార్?
క్వశ్చన్ పేపర్స్ షేర్ చేయకూడదమ్మా. క్వశ్చన్ పేపర్స్ అట్లా అని కాదు. ఐ టోల్డ్ యూ ఇన్ సైకాలజీ దేర్ ఇస్ నో చాయిస్, యూ హ్యావ్ టు రీడ్ ఎవ్రీథింగ్. Really, you want qualifying is different and learning subject is different.
Yes, so both are different.
I only interested in learning subject, not just qualifying.
Yes.
I am having some question paper. I don't say no. I don't have like that, but I have.
Previous question
2022,
papers, sir.
22 question papers I am having. 2022. One of my friend has given to me just for observation how those questions.
Morning.
Sir, please share, sir. We will take a screenshot, sir.
Principles of psychology, sir. Chapter wise టాపిక్స్ ఎస్ఏకి ఎట్లా చదువుకోవాలో చెప్పారు. ఒకసారి మీరు కూడా అట్లా చెప్పేయండి.
అట్లా చెప్పకూడదమ్మా, ఎందుకంటే మీరందరూ మాస్టర్ స్టూడెంట్స్. ఏదో 10th క్లాస్ పిల్లల కంటే ఇంపార్టెంట్ క్వశ్చన్లు ఇవి వస్తాయండి, చదువుకోండి అట్లా చెప్తారు.
ఎలాబరేట్ ఇప్పుడు నేచర్ స్కోప్ ఎట్లా చెప్పారు, అట్లాగే నెక్స్ట్ కాజెస్ అబ్నార్మల్ బిహేవియర్ అది ఉన్నాయి కదా సార్.
ప్లీజ్ ట్రై టు అండర్స్టాండ్ అఫీషియల్ సైట్. ఐ కాంట్ టాక్ ఎనీథింగ్ మోర్ దాన్ దిస్.
ఓకే సార్.
ఓకే.
Yeah, I understand, sir. No problem, sir.
Okay.
So thanks for your
anyhow,
support,
I hope everybody will do better in my subject.
Super,
I am
sir.
hoping all my students will fare very better in my their first year examinations.
Definitely, sir. Definitely.
Okay. Even if anybody want any help also, they can meet me personally also. I am available always.
Sure, sir.
Sir, can you provide your number?
Thank you, sir.
Thank you.
Hello, sir. Can you provide your number?
Thank you. Thank you very much.
Thank you, sir.
Thank you, sir.
Thanks. Thanks.
Thank you, sir.
Thank you.
Thank you, sir. Thank you.
Thank you very much.
Thank you very much, sir.
Thanks, Amma.
Thank you, sir.
Thank you, sir.